Health Consultants is an organization that was created 3 years ago here in the Woodlands area. We have another office down in Houston, but we concentrate on, or we focus on non-surgical vision correction, and that's what we'll be talking about. But what we do, we put our heart and our passion in creating customized eye care or eye health solutions. And what that means is that we don't do things the way that you usually have done when you go to an eye doctor. And what that means is that we use ways and protocols that are only used by a few. That obviously is maybe a concern because, well, so if it is so good, how comes not everybody else is using it? And that's always a very good question. Unfortunately, in life, we have a lot of those situations, and many times the answer is that because it takes a lot of hard work. So we do that work. So when you come to the office, we try to customize everything we do. So with that, that's what it means. We innovate. We have products, we have services. We serve our patients in a way that is very innovative. Just to give you an example, corner molding for hyperopes, for people that are just normal far away, but they can see up close. Nobody else in the Woodlands is doing that. I think there's only a few in Houston, maybe a handful, 2 dozen is only in the United States. I trained most of them. So it's very unique. So we have an integrated approach. We definitely use allopathic protocols, and what that means is that we use conventional treatments, but we also use natural, nutritional, alternative, holistic protocols. And I put all those names so you know that, so everybody understands what that means. And we look for cost. We just not only manage the symptoms, but we like to manage the root cause of problems. And that's where the hard work comes. How do we figure out what the cause of the problem is? Go into the true, try to find a true answer that will identify that problem that we came to see it for in the first place. So some of the conditions we treat. Anyway, that's a little bit of what I am. I have a very Texan accent, you can tell, a very deep Texan accent. I was born in Madrid, Spain. I was trained there first, and then I came here. I graduated from the University of Houston with a doctorate of optometry in 1999. Been 14 years in practice. And I specialize in non-surgical corner molding. We have about 400 cases in the program at this point. We do some lecturing here and there, and I provide some consulting services for other doctors that are trying to do the same thing. Some FDA disclaimers. Getting into the meat here of the thing, we're going to be talking about presbyopia. And what that means simply is that, well, I can't read up close, it kind of sucks, right? And that happens to everybody after a certain age. 40, 45, 50 years old, everybody gets there, no matter what. So that's probably a better definition of what the condition is. Everybody understands it very well, right? So why does that happen? How come, I was seeing just fine, all of a sudden I can see up close? Well, it has to do with a very tiny little thing that we have inside the eye called the crystalline lens. And the crystalline lens is supposed to be flexible. Well, like every part of our body is not as flexible anymore once we get to a certain point. My daughter was showing me how much you can lift up the leg, and she was telling me to do the same thing. I was trying to get all the way here, but she said, "Dad, what's wrong with you? You can do it." Something about flexibility. So the eye is supposed to be flexible. It's not as flexible it's no longer flexible as it used to be. So for those people, a lot of folks out there that had perfect vision all their life, they were spoiled with perfect vision. All of a sudden, they find themselves using this thing that they hate, glasses, ever. I mean, for me, I never wore glasses. I was just fine. How come I now need glasses to see up close? Because I think it's, in the United States, I think it's up to 75 million people like that. You know? So it's a pretty large percentage of the population. So, And they hate glasses, like we just said, right? Well, this is the crystal lens. We were just, let's see if I can get to that. This is showing just a little video representing or kind of showing you how that little lens inside the eye is supposed to flex. So we can see things up close. The problem is that with time, that lens loses the flexibility. It becomes stiffer, and that's this totally physiological process. Like I said, it's the rule of life. We all get there one way or another. And when that happens, we start seeing blurry up close. If somebody, the person is also a little bit farsighted, eventually they're going to see a difference far away as well. So more than 169 million people in the United States were vision correction. Out of this group, more than 63 million people up to age 64 are presbyopic. That was 2010 figures. I am sure right now it's probably more than that. So, anybody knows what that is? We all know that, right? By the way, how many people, if whoever wants to share, needs glasses to see distance or near? So, half of these, right?
Glasses.
Well, I mean, some type of correction, I guess. Anybody that needs some kind of lenses or corrections to see. So you see, we're pretty, you know, pretty much 80%, right? 70%. So at some point, one way or another, everybody got a relationship with those little devices, right? So the problem with glasses is that if you just use reading glasses, when you see far away, you see blurry, right? So you have those little granny glasses that you put like this, and then you look through the top. And I remember that. We still see that all the time. And it's probably not the most convenient way. So after that, eventually at some point, technology got a little progress there where you could get distance and near on the same lens. And you would do that by putting a little lentil on the bottom, and you would see the line, and it's sort of ugly, and people don't like it, they're old, etc., etc. Right? And then you have the PL or multifocal lenses, and what that means is that you get distance, near, intermediate, everything. But then people, a lot of folks have a hard time adjusting to those, really. I mean, we see them all the time. Well, listen, you educate and everything, and you go through a long process. And how many rechecks we get on those? They're not the easiest thing to work with, because when you move your head, you are like, oh my goodness, this is so like dizzy, and I see okay now, but now I see blurry, and you know, it's just confusing. It takes a while to adjust. Eventually, once you get adjusted, you're okay. But anyway, so you still have to wear glasses, but at least now you get distance, near, and everywhere in between. Then you have contact lenses. I have no stock whatsoever on SIVA Vision, so you know, I just took that picture, not trying to advertise it. So contact lenses, you have if you have a problem with distance, you have a problem at near, you're going to need one eye for distance, one eye for near, right? And then you're walking with one eye that is looking distant, one eye is looking near, so it's like going crippled, right? Like this, right? No, that works, you know, all the time. So a lot of people complain about noise. So they're looking far away and say, Doc, you know, there's something in there, but you're seeing 20/20. Yeah, but my brain is just telling me that, you know, it's blurry. And up close, really, it's not that good. And you know, I have these 3D glasses, I want to watch a movie. Oh, those don't work that well. Well, why? Because it just disrupts the binocularity, or the ability of our eyes to see depth perception. Some people adjust because the brain is so amazingly sophisticated. They adjust to a lot of stuff that we, you know, there are a lot of challenges that we inflict upon. But anyway, so then we have modifying model vision, which is sort of similar. Then we have bifocal context, and then we have multifocal. I don't know, any of you have worn any of those contact lenses? Yeah, the problem with this is, well, first of all, patients over 40, we have dry eye many times. We don't have as many tears. Those contacts suck up your own water, so somewhere during the day you have dry eyes. Plus, you have sort of the same problem. You have issues with your distance and your near. It's never perfect. It's just, there's always something there. And you kind of deal with it. And some people adjust, some people don't. So we just talked about that. And then we have the surgical options. That's not looking pretty good. Nobody really wants to have their cornea peeled like that. Yet there are hundreds of thousands of people that went through this amazing technology and worked very well for them, you know. The problem with the surgical option is liabilities. I mean, it's a big liability, and some people are good at taking risks, and some people are not so good. And you see, if things go really well, you're going to be okay. If they don't go so well, you're going to be just not so well. And if they go wrong, you're going to be really screwed, you know. So that's the problem with this. How many of those do get to that point? Well, you know, we could talk about percentage. I don't think I want to talk about that. But the point is that surgical options are never safe enough. And they come with their own set of their own baggage of post-op complications, with post-op side effects, etc., etc. So, and then the other thing is that LASIK, for instance. LASIK doesn't work very well for people like the ones we're talking about. Why? Because you're correcting one eye for distant, one eye for near, and then you don't like that we just talked about. One eye is not seen clear far away, it's just seen clear up close, so you get your brain kind of trying to handle the situation, and for some people it's like, well, you know, it's better than nothing. But overall, it's not the perfect solution. Then we have a really nice permanent solution, pretty permanent. Probably, if you can call something permanent, this is the most permanent you can think of. This is about $10,000 procedure where you poke your eye open, you remove part of your eye, and then put another artificial lens in there that is multifocal, and you get some relatively reasonable, good vision up close. You try to see very small stuff, you probably won't see it, but at least it will get you okay 80% of the time. So what else can we do? So we run out of options, right? That's actually what I came here to tell you.
Yeah.
That's the best option right there. It's become pretty cheap now.
Arm extension.
So no surgical cornea molding. This is the new alternative. And this is sort of a modality where you get the best of both worlds. You get to see with your naked eyes, yet you don't have to cut your eyes to see clear with your naked eyes. So you got it, it's right that perfect niche in the middle, where you're not wearing anything, but at the same time you didn't go to the OR to get your corneas burned or cut, or etc., etc. It is safe, it is effective, it is adjustable, it is reversible. Make no mistakes, our eyes are life, and we change, our eyes change. So calling something permanent is just a long shot. Things change, our eyes change. The good thing about this is that you can make adjustments. You can make safe adjustments, effective adjustments, if you need to. Doesn't mean you need to right away, but if you do, you have no liabilities in terms of what you can do, because you can adjust it. Oops, sorry. And then you get multifocality. We just talked about one eye for distant, one eye for near. Our eyes don't like that. Our brain doesn't like that. What we recreate with this cornea molding is multifocality. And I'll show you a little thing in a moment, but what that means is that both eyes are going to be seen far away and up close. There's still one eye that we put more emphasis for the near, but both eyes work together very well. And that's because they are both looking at the same range. You see that range here is overlapping, it's been overlapped between both eyes. They are both between that range of vision. When you get one eye for near, one eye for distance, maybe they overlap this little part here. The rest is two different images. So the brain has a hard time using those. How do you do that, right? It is very versatile. That means that we can treat many different prescriptions. And it is natural. And what that means simply is that, coming back to, you know, what we stand for, we stand on natural things as much as we can. Anything that we can do that is natural, that is non-invasive, that is not synthetic, that is non-chemical, we'll try it, and we'll complement it, and we'll implement it if it offers a significant benefit. A natural means that we're just gently molding the tissue of your cornea without cutting it. We're just molding it. This is a long sentence, and I'm not going to say it again. I think this explains it much better. And what you're going to see here is what happened. Well, it's just showing here how the light focuses inside the eye on those that have trouble seeing clear. You see the light focuses either before it gets to the retina, and that's called nearsightedness, myopia, or it focuses behind the retina, and that's called hyperopia or farsightedness. So what we do is to modify the shape of the cornea. That's the cornea right at the front. You're going to see it highlighted now in a moment. So what we're going to do is to design a corneal mold, which really, in essence, looks like a contact lens of some sort. You know, you look at it, it's a contact lens. Of course, it's much more sophisticated than that. But those molds are worn just to sleep. So basically, you go to bed, you put those in, and you just go to bed and sleep, hopefully. And then what they're going to do is what those molds do is to redistribute the tissue of the cornea in such a fashion that it will create a corneal curvature change. By doing so, we're changing the refractive status of the eye, so we get to focus the light in the right place. In the morning, you wake up, you pop those out, and you're good to go. You don't need to wear glasses, you need to wear contacts, you need to cut your eyes open, you just go. So that's the basic essence of how corneal molding works. Now we're getting to the end of the presentation here, but you see here a patient that was a +3, that means a pretty high hyperopia. The top picture here, that's a corneal map shot. And you see those colors and you're going to think, what am I looking at, right? Well, basically, when you see a blue color, what that's telling us is that the cornea is really flat. When you see a hotter color, what you're seeing is, what is telling us is that the cornea is very steep. So you see the before and after. We see how we moved tissue from the mid-periphery and brought it all to the center, create like a little mound, like a little nipple, if you will. So that's the difference map, and what that's showing here is just the difference before or after from before. So you see how much change we inflicted on the cornea. But we do it in such a way, I don't know if you can see it well, but you see this, and this is just to show, I'm sorry I'm a little passionate about technicalities of it, but right here, that color is beyond red. This color is very, very like purple. Purple means even more curved. So you see that at the very center, at the very center, sorry about that, the cornea is very steep, and as it runs away from the center, it becomes flatter. There's no way at this point, and I say it out loud, proud, and short, there's no way you can recreate such an effective multifocality with any other option available. You just have to design a lens, a mold that will do that on the cornea. The science is, I think, starting now. I mean, the future is amazing. We are working now, I don't know when it's going to be legal or not, but they're working on stabilizers. Hopefully at some point it's being used for keratoconus and other purposes. I'm personally hopeful that it will become available for Ortho-k or corneal molding as well, where we could stabilize the corneal shape for longer periods of time. I think that would be an amazing thing to happen for this procedure, for this technology, and for patients that want safe options or non-surgical options to vision correction. I added there some of the things you can do. You want to keep your crystalline lens, that little flexible thing inside your eye, healthy, and I included there antioxidants with sources of essential fatty acids, hopefully plant-based. There's a topical solution that I've been used with relative success. We're now doing some trials on that with using a large semi-scleral lens that may become more effective option. And then there are some homeopathic solutions there that listen, you have cataracts and you don't see nothing of this is going to work. By the way, let's be realistic here. There's nothing wrong with having cataract surgery, you have cataracts, but this is totally off topic and it's not the subject of this presentation. But anyway, so we got to the end of it. Those are my two little engines, the one that pull and the one that make you be proud. So, this is, I don't know, I'm sure you guys have questions. Now is the time. Thanks so much for your listening. Appreciate it very much. Yes, sir.
Who are candidates for this type of procedure?
The question is, who are candidates for this procedure?
Who are not?
Who are not candidates? Who are not good candidates? The poor candidates for these procedures are the ones where this procedure won't work very well. What did I say? That's yeah, duh. So there's, you see, if the cornea is sick, they won't be good candidates. I've done some corneal molding on LASIK, but I don't like it. I have a very, actually, used to preserve the privacy of the patient. Super nice indeed. A doctor, an MD doctor that had LASIK, was seeing blurry flows, and so we did it, and he's super happy, and it works, but I'd rather not. Now the cornea is unhealthy. The cornea has a progressive condition. We don't want to do that. If the prescription is way too high, we can't do that. So you have parameters, limitations, what you can do, you cannot. If the prescription is too low, there's no point you want to do this because it doesn't serve any purpose. So basically, you want to have healthy eyes, first of all, and then the prescription has to be within the range. And the range is pretty wide, and we are actually stretching the limits of what we can do as we go. I mean, what I'm doing now is quite different to how much we could do a year ago, and it continues to change. This is a very fast changing technology. Yes, go ahead.
What if you are a candidate and you're doing this, but glaucoma runs in your family? So are you monitoring that with that patient at all times? And if they don't have glaucoma yet, but it does run in the family, maybe they won't get it, but it's pretty prevalent most of the time. Would that be a candidate if their eyes are okay right now? Yeah,
that's another great question. Is glaucoma a contraindication for corneal molding, or how you handle that? The answer to that is, well, you see, glaucoma is something that happens at the optic nerve level. We're just changing the front of the eye. It wouldn't interfere. The only problem is that if they're on certain treatment for cataracts, we would have to see what kind of treatment it is. It just dropped. We have a few patients that do have glaucoma and they're on corneal molding, they're perfectly fine. It's like saying, well, can I wear contacts if I have glaucoma? Well, I don't see why not. But it's definitely, you see, when we do a corneal molding evaluation, one of the things we do is a very, very comprehensive eye exam. I mean, you can't imagine every test that we run is way beyond the kind of beauty. I mean, way beyond the standards. We check for, we do a tomography of the optic nerve. We take the ultrasound of the cornea. We take high definition pictures of the back of the eye, the optic nerve, etc. So, yeah, but it's just not necessarily a contraindication. Yes.
So you mentioned there was a range for candidates that would qualify. What is that range in numbers?
Well, if it is an adult, if it is a kid, it's a different story. Because for myopia, it's different. In general terms, I'd go on as high as -12 diopters with success. I don't think I can do every -12 and call it a success. The good thing about this is that you are not cutting the cornea, you're not destroying tissue. If it is not working well, we can always go back to plan B without causing any harm. But for adults, I would say up to 6 diopters. After 6 diopters, we run into risk of glare and some other things that are pretty much a big deal in adults. 6, 7 diopters the most. If it is hyperopia, up to 5 diopters maybe. If it is kids, for kids, what we're doing is slow down or stop progression of myopia, so we'll try it anyway, you know, because, I mean, for kids, we're talking about their future, and what we're doing right now, getting them glasses, is nothing about their future, just their present. We're masking the problem. It's like going to a heart doctor and say, well, here's your pill, so you don't notice that you have a heart disease, and then you go next year, and they give you another stronger drug because your prescription, I mean, your condition went worse. Well, don't worry, I have a stronger drug for you. And then you go again next year, and they, oh, don't worry about it because I have a stronger drug for you. but my heart is getting worse, oh, don't worry, you won't notice anything. Well, can you imagine doing that for kids? I mean, there are 3 doctors now, and the next year is 4 doctors, and the following year is 5 doctors. So by the time they're 25 years old, they are 7 doctors, 8 doctors. We ain't done anything about those poor kids. Why don't we just stop progression of myopia in the first place? It's nonsense, it's crazy. I'm very adamant, I'm very vehement about it because I think it really drives me nuts. You know, every doctor should be recommending this for kids because we now know that it slows down progression of myopia. How in the heck? We're not doing that. That's a different story for a different workshop. But I think I got a little bit of tour from your question. I do that, I'm sorry. Yeah, go ahead.
Do you find insurance companies covering the procedure?
No, it's considered cosmetic. At this point, there's no insurance coverage. Some insurance will say, I cover you 10%, just like LASIK. You know, they say, well, we'll cover you, whatever. We honor that. If that's the case, obviously what we're going to do is to try to help people serve them the best, and we try to make sure we can bring it to a point where it's reasonable enough so people can get it done. There are payment plans of all sorts, so there's a lot of facilities in terms of payment plans and financials. Yes, ma'am.
Okay, 2 questions. One, I want to know, I have excessively dry eyes, so would that allow me to put on these contacts, or?
Yes, one question is dry eye. What we do I don't think you do. I'm sorry to disagree with you. The question is, well, if I have dry eye, can I do corneal? If you had very dry eye, you may be very symptomatic, but people that have very severe dry eye, they have red eyes, I see beautiful eyes there, I see a lot of red. Those people are really in trouble, they're miserable. But we do put these patients on a program in conjunction with the cornea molding to improve the quality of your tears. We have a patient here that actually is going through the process right now.
I had awfully, and I have to go back and actually finish it. But when I went to Dr. Arroyo, my eyes were like zombies some days. They were so red. And people were like, what? So, and I thought it was allergies. I had no clue. So I went to Dr. Arroyo because I wanted to do the cornea molding. And you can tell them how my eyes were, like terrible. And he did the homeopathic stuff, and he's like, that might be a little strong. And I was like, oh my God, it doesn't affect me. Is it that bad? And because, well, I have to give you a warning just in case. But he did the whole thing. Now my eyes feel really good, so now I need to go back and do the cornea molding. Because I'm one of those that doesn't want to do the LASIK, all these types of procedures. The only time I went to hospital was when I gave birth to my son, and that's about it. Me and the hospitals are not in good terms. But I did have, my eyes were red like yourself when I went to see him.
So Kiki had extremely red eyes and very miserable, so now they're getting quieter. So we treat that along the way. I think, we have in this venture, this little journey of us with cornea molding, we made some really nice friends. And we meet some really, really nice people. It's a blessing just having them. I met Joy Grayson because of cornea molding, and that was, I always said that we advertise on Living, and he said, well, Living may just not give us anything, but at least we got Joy, so it's worth it. And there's definitely more than I can say. But I'd like to bring to the floor our dear friend, Andrea Sale. She's actually a cornea molding patient. She's currently in the program. And I think it would be good if she would mind to come up here. So you guys have questions for somebody real that is going through the process. Maybe, I think she can answer it much better than I. So here's Estelle.
Okay. Thanks. Well, I'm probably one of his oldest patients. I turned 66 at the end of this month. And I actually wore glasses off and on from the time I was 8 years old. I went through contacts, I went through bifocal contacts, I tried just about everything. I don't think there's much that's out there. The only thing I did not do was LASIK, because just the thought of that just made me cringe. It was bad enough that I had to wear glasses. It was like, yeah, I'm gonna go have somebody slice my eye. So, as time goes by, it was getting to the point where I was having to go in for new lenses every year, and then I was miserable half of that year because I probably need to go back again. I'm very, very frustrated. I'm really active. I love to be outside. I love to garden. And so half the time I couldn't see what I was doing because I was taking my glasses off because they were driving me crazy. Well, I came to a luncheon. I live in Augusta, and I came to a luncheon, and here's Dr. Arroyo, and he's talking about this, and I'm like, oh my God, it's an answer to prayers. And all of you that wear glasses or contacts or whatever, I'm sure know what I'm saying. Well, so I made an appointment, and poor Dr. Arroyo, kind of looking at me like, really? So he does all the testing, and he actually attempted to talk me out of it. One of my deciding factors was that I do have the beginnings of cataracts, but they're very slow. And so I said to him, well, how many years do you think I have before I can do cataract surgery? And he said 10 to 12, and I went, oh my God. Not that that wasn't good news, it was just another 10 to 12 years that I was going to be dealing with glasses or contacts or whatever. So I finally just looked at him and I said, that's it, I want to try this. And he's kind of like, oh, okay, all right, we'll do it. I'm standing before you today. I can read, I can see to drive, I do not wear glasses. As a matter of fact, I cannot wear my glasses. I have not worn my glasses since the night after my first contact wearing.
Wow.
So for those of you that are on the edge on this, I started looking at the cost of what it was going to cost me every year just in lenses alone for my glasses. And then I waited over 10 to 12 years for cataract surgery, and I'm ahead of the game a lot, having done this. They are not painful. They do not bother me at all when I go to bed at night. I still wear them every night, but I actually had a little bit of a problem and had to not wear my left contact for a while. I was still seeing okay. So what you all need to do is just be brave, believe in yourself, and believe in this wonderful man, because it's a gift that he's giving to the world. I cannot begin to tell you what it has meant to me. And my daughter, who has a tendency to be Miss Skeptic of all time, when I told her that I was going to do it, said, have you lost your mind? And I went, maybe. But how am I going to know if I've lost my mind? She came over the day after I wore, after I took the contacts out from the first night of wearing them, and I'm just looking at her. Would you like me to read this business card? Would you like, what is it that you would like me to do to prove to you that this works? She's looking at me like, are you kidding? But I'm the crazy one, right? So, all of you, just believe in yourself. Poor Dr. Arroyo was just going, oh God, there's no this. Here I am. So, you have to give yourself chances in life. And you know what? There's a thing that I've started, of course now I'm older than 30, but one of the things that I have understood from even my life is my missed opportunities that I passed on, that I didn't step up and attempt. And at this stage in my life, I'm like, yeah, get out of my way. So, and most of you in this room are a lot younger than I am, and I'm just giving you some sage advice. Don't walk away from opportunities that can give you something wonderful. So, make appointments today. Are there any questions?
I can work.
Yes.
I wasn't clear, once you start on corneal molding, is this something that I would have to do for the rest of my life? Where at some point does it stop and the cornea is molded properly?
Yeah.
Do you want me to? Yeah.
Well, why don't you give her the
Okay. What basically happens is, for most of us, you're going to go through a program where your eyes are changing and things are starting to work and everything. But what's going to eventually happen is you may, depending on you, you are only wear them maybe once a week, a couple of times a week. Whatever it is that you necessitate for you, what works for you. I mean, I'm still wearing mine every night, but it's getting to the point that I really don't have to.
Let me give you this definitely very good question, obviously, and this is something we get a lot, you know. I mean, so am I going to be doing this for the rest of my life? You know. When you buy a computer, when you buy your car, a phone, you know, phone. You buy a phone, and well, don't. So the seller will tell you, the salesperson, make sure, don't forget to plug it in tonight so you can use it tomorrow. And you're going to say, am I going to have to do that every night? Well, at this point, this technology is like that. Look, there's nothing new. Okay, there's nothing that you can do like say, well, if I do this magic pill will get me fixed for the rest of my life. Now this is just conveniency, but it's not magic. Like Andrea just told you, there are some people who just wear them every night. I mean, once a week, twice a week. For these kind of cases like her, eventually maybe every other night, every third night, and we have those kind of patients. For young people, many times it's every night because they have very mobile corneas. Like, you know, your daughter still every night, right? Yeah, and then we're changing now the protocol that may last a little longer. In the near future, eventually, like I was telling you before, this may change. But make no mistake, there are tons of post-LASIK patients, individuals that come ask us, can I have this? I have LASIK. Why in the heck would you ask that if you have LASIK and know it's permanent? Nothing permanent. For some people it may last a few years, it doesn't matter. This is just the way to have your naked eyes see without glasses, without contacts, with naked eyes, without surgery. And it's only getting better, but at this point, yes, it is your phone that you have to plug in at night, or the car that you get out of the dealer and then you last for 2 days and then you put some gas, otherwise you can go back to the dealer and say, I didn't know I had to put gas. Yeah, you have to do that. Yeah, but it's a very, very good question because, I mean, yeah, everybody asks that. Yeah. Hopefully at that point it will last longer, and that's where the technology is going. But you see, this is the beauty of it. It is reversible. By being reversible, what that means is that if something new comes out, you can, you know, pop off this wagon and jump on the new one because your corneas are still virgin, they're still the way they used to be. When you modify permanently the shape of the cornea by removing tissue of some sort, you are limiting, shrinking the number of options you have in the future, right? So you stay ahead of the game by saying, you know what, I want to keep all my cars with me just in case in the future I can, again, adopt this new technology, whatever.
I just want to know in terms of time spent, I'm really busy. I just want to know, is it just putting the contact in my eyes and then that's it, or is it time consuming?
What you're gonna do is you're gonna do whatever it is you do.
Repeat the question. Repeat the question.
Okay, she wants to know if how long it's gonna take her to do all of this. You know, how long is she gonna have to, because she's very busy. You're gonna do whatever you do before you go to bed at night, okay? It takes me less than 5 minutes. I take them out of the little case that they've been sitting in all day while I'm off doing my life. And then I get ready for bed, and then I pop them in. There's a solution that you put in, pop them in, and you go to bed and you go to sleep. And the beauty of this is you see really well with them on, because I don't always go right to sleep. I read a little bit, or I watch TV, or whatever, and play on my iPad. So, I mean, it takes you less than 5 minutes. It's just nothing. It's like cleaning your eyeglasses in a sentence. So you can see. It could be simple. And the thing is even if you have to wear them for the rest of your life every night, who cares? I mean, it's supposed to be done out in the morning and gone. You know, there's no, I mean, it's not any worse than you dealing with your glasses all the time or your contact lenses. Anybody else? Yes?
I've never worn contacts, but I understand that they had to be changed every so often. Does this have to also be changed, or is it?
Yeah, I want to make a point, just with one little moment here, about the time. We ask all the time, after 3 months or so, so how long does it take for you to get them? Well, taking them up, it's probably a minute, you know? We say this is a 5-minute-a-week process. It takes 1.5 minutes to put them in. Eventually, it should take that time, and we'll see. I mean, this is in second nature. You become better. It's done. And some people, kids do it in a certain way, and they need their parents' help, and then eventually they learn. Adults learn faster. Women are so much better than we are. We're, believe me, I mean, they're so much brighter. They're so much more disciplined. They get it. Look at this. It's just all girls, you know. I mean, they get it. They get it. And we are more like, I see good, buy it, you know. And they're more into details. And so anyway, it takes very little time. Now, going back to your question, how long do they last? Well, this can last really long. You know, we have patients that 4 years later they come back. You know, I was in College Station studying, and finally, back to Houston, could you stretching my eyes. Well, hello, it's about time, you know. Your eyes could have fallen off, But so it can last for long. Now, after the average between 2 and 4 years. Now, what happens if you need to change it and get a replica? We just order replicas to the lab, and that's it. So it's a pretty easy process. Yes.
My question is, for someone like me who wears contacts every day, just the regular kind, is there a benefit to wearing them at night versus me just putting contacts in the morning and seeing all day long?
Well, there are many. Huh? Yeah. Well,
I can see better.
the vision. Some people will say that, and Andrea claims that he can see better, and some people do. I mean, Andrea was a very, very specific, unique case. It kind of marked order. It was just a challenging case to do, and I just had a very candid talk with her, and then we went through the process and and it turned out good. But regular cases, straightforward cases are usually straightforward. But the benefits, oh my gosh, it's so many. But one of them, just think about it. How many hours do you wear contacts during the day? 12 hours. So you put them on at 7, 8?
Well, yeah, I guess in the morning when I wake up,
Right.
I go to bed.
And then you get them off at whatever time you go to bed, right? So it could be around 15 hours, right? 12, 15 hours sometimes, right? Well, they are in your eyes 15 hours, and they're preventing oxygen to get to your cornea, those contacts. It doesn't matter if you're wearing contacts that are high breathability or not. Well, compare that with wearing this at night, an average of 8 hours, and having your eyes open during the day and your corneas breathing. I mean, just that. Forget about dry eyes. Forget about trouble going to the pool and, I have my contacts in. Take them out, I can see. I mean, a lot of people find different reasons why. I think it's healthier for the eye. I think it's more convenient. And eventually, you have a low prescription or average prescription. You don't even wear them every night in the 70s. But it was until recently that we couldn't do what they envisioned back then. The technology wasn't there. So I said, well, I want to learn more. So when I wanted to learn more, I went all the way. Look, I studied in Spain optics and optometry. This is the best country in the world for my research, but one of them is training, So when I studied over there, I said, no, this is not enough. I want to learn more. So I came here, and I wanted to learn more, so I went through the whole program. So when I studied cornea, it was kind of the same thing. Yeah, I want to learn more. So I got involved and certified by the best technology software available, and I went all the way. And now we just put everything into it. So it's our heart, it's our soul, it's our DNA. So I got into it like that. Now this is all. I never see those malls when they're doing everything. This is all done online. I have softwares that we use. We have a machine, different machines that grab data from your corneas, from your eyes. That data is extrapolated into another software, so we design it there, and it goes over the internet to a lab. The lab grabs it, grabs the 10 pages data, and they make the most of it. It's funny because some people, can you give me my prescription for my mole? Well, here it is. It would be 10 pages long, So it's more than just, it's hard to explain. I mean, it's really simple from our side. What happens on those plates and how they do that, I don't know. I know how to use the software, and that's what I do. If I have to do it myself, God, I will be in trouble.
And do they tear, I mean, she was talking about that at nighttime, is it like a contact that it could tear easily?
It's hard.
It's hard.
Yeah, it's a flexible material. It's a gas thermal version of what is the hard contacts. Hard contacts have a very bad press. It used to be the glass, little contact. This is not like that, but it's firm. It doesn't. It can break. Yeah, you step on it or something. Right? Yes.
So about how long does it take? I mean, I know for you could see it overnight, but, does it vary how long somebody takes for it to, or you
Well,
don't have to wear your glasses anymore?
You're gonna be going through a process, okay? And I have another friend that went to the same meeting I did, and we were both the guinea pigs for all our other, but we were like, hey, we're doing this. And she's had some little minor issues that Dr. Arroyo's fixed. I mean, so she did have some problems initially, seeing as well as she wanted to. I, however, was like, oh my God, I have a life again. I mean, I was very fortunate. But nothing that you're gonna go through is not gonna be fixed. I mean, in other words, he's going to watch you very closely. And you're going to, when you come in, you say, well, I'm not seeing very well. I just can't imagine you not just waking up the next morning and doing what I did. I just see you just all going, but you're all a lot younger than I am, for one thing.
Oh, no, I'm not.
Well, all right, welcome to my club. Okay, so.
I'm not. I'm there with you.
Yeah, but the thing is you wake up and you go, I cannot believe that I wore these one night, and I can see. Because I started mine on I think the 3rd of July, in essence. And he had me call him on the 4th of July. Okay, how are you? How's it going? How are you? I go, I can see. I mean, it was phenomenal. So, it's not anything much to worry about. I mean, in other words,
I just wanted to see kind of.
Right, I saw.
What's inside.
One
Because
of
I
those.
can see difference, it's just this stuff.
Well, and that, to me, I mean, I
To
would.
me, that's the worst part.
Okay, I wore graduated lenses. For
I
me to
never
work
done
on my computer, it would drive me absolutely berserk. And if I was on my computer for more than an hour, I was miserable because my neck hurt, my bones hurt, because I could never find the sweet spot. You know what I mean? It's the whole time. That day, I went to bed, I was like, this is the real test. I got on my computer and I was, oh my God. I didn't have to move my head. I didn't have to move the screen. I didn't have to do anything. It was like heaven. So, all I can say is, don't miss this opportunity for yourself. Give yourself a gift that you will be thankful for forever. So, anybody else question?